Let's break it down. Donald Trump has picked his next big culture war target: federal money for gender-affirming care. In simple terms, he's moving to make it harder or impossible for doctors and hospitals that rely on Washington to provide medical care to transgender people, especially young people. I'm Imran, a Middle East-based analyst who follows US politics, law, and global affairs. In about 3 minutes, let's walk through what this kind of move actually means, who it hits first, and why the debate around it is so emotionally charged. If you find this kind of breakdown helpful, please subscribe and hit like. It really helps the channel grow. First, what is Trump actually trying to do? Trump and his team are signaling that federal funding should be tied to a new rule. If a hospital, clinic, or university provides gender-affirming treatments, things like puberty blockers, hormone therapy, or surgeries, especially for minors, they risk losing money from Washington. In practice, that could mean threatening Medicaid or Medicare reimbursements for certain procedures, limiting federal grants to hospitals that run gender clinics, pressuring research programs, and teaching hospitals that train doctors in this area. On paper, he frames it as protecting children and stopping radical ideology in medicine. In reality, it's a federal government trying to use its wallet to reshape what doctors can and cannot do, even in states that currently allow this care. Second, what exactly is gender-affirming care? This phrase gets thrown around a lot, often without explanation. It actually covers a range of things. For children, mostly social support, counseling, mental health care, sometimes a new name or pronouns, and in some cases puberty-blocking medication to slow changes while doctors, parents, and the child decide next steps. For teenagers and adults, hormone therapy, and for a smaller group, surgeries carried out under strict guidelines and after long medical evaluation. Major US medical associations, pediatricians, endocrinologists, psychiatrists say this care can be medically necessary for some trans people and can reduce depression and suicide risk. Critics, including Trump, argue it's experimental, dangerous, and should be stopped, especially for minors. So when you hear cut funding for gender-affirming care, you're not just talking about one surgery. You're talking about a whole package of medical and mental health services being pushed into a political battlefield. Third, who is actually caught in the middle? The most obvious group is trans youth and their families. In many US states, care is already banned or severely restricted at the local level. A federal funding crackdown adds another layer. Even in states that legally allow treatment, hospitals might be scared to provide it if it risks losing national money. Doctors and hospitals are the second group. They're stuck between medical guidelines telling them what the standard of care is and political rules threatening punishment if they follow those guidelines. And then you have the broader system. Once Washington starts deciding which kinds of patients deserve support, it sets a precedent. Today it's gender-affirming care. Tomorrow it could be reproductive care, addiction treatment, mental health services, anything that becomes politically controversial. So let's break it down one last time. Trump's move on gender-affirming care isn't just a tweet or a rally line. It's about using federal money as a weapon in a culture war, making life harder for some of the smallest and most vulnerable minorities in the country, and putting doctors in the crosshairs of politics. You don't have to agree with every medical protocol to see the pattern. When governments decide that some groups are too controversial to treat, it's rarely the last time they cross that line. I'm Imran, this is Imran Breaks It Down. If this helped you understand what's really at stake, please subscribe, like the video, and share it with a friend who keeps hearing the slogans but not the details. And tell me in the comments, do you think medical care should be decided by doctors and patients or by politicians and funding threats? We'll keep breaking it down together.